Hello student, now we are going to discuss hemodynamics, the dynamics of blood flow. So in this chapter we are going to discuss a few basic principles of physics which are applied in cardiovascular system, right? So we are starting our discussion with the distribution of blood volume. Means we all know that our total volume of blood inside our body is approximate 5 liter, that is equal to our cardiac output. If this 5 liter is equal to 100%, then how this blood is distributed in different parts of vasculature, that we are going to discuss. So I am drawing a diagram, a schematic diagram of a heart. Within the chambers of the heart, the percentage of blood volume that is present is 7% of your total cardiac output, or 7% of your 5 liter blood volume. Now, if we discuss that what percentage of blood is present at the level of pulmonary artery, pulmonary capillary, so this is pulmonary capillary and this is pulmonary vein, schematic diagram, okay. So this is pulmonary vein. Remember, 3% of total blood volume is present at the level of pulmonary artery, 2% is present at the level of pulmonary capillary, and 4% of total blood volume is present within the pulmonary vein. That means if I add up all this volume within the chambers of the heart, 7% plus 3% plus 2% plus 4%. That means this 16% of the blood volume is present within the lung and heart. So I can say that the central circulation contain how much percentage of blood? Only 16% of total blood volume. So remaining percentage of the blood volume, I can easily understand that the peripheral circulation contain 84% of blood volume. So how this 84% blood volume is distributed in different parts of vessels, right? So to understand that, I am drawing here, suppose this is aorta. Aorta will give rise to arteries, then arterioles, and then arteriole will form the capillaries. So this is the basic schema. So capillaries mean this is the representation of all the systemic capillaries, and then it will form the venous system, which are ultimately going to drain at the level of right atrium, right? So if I write down the distribution here, aorta, artery, arterioles, okay, arterioles. Aorta 2% of total blood volume, arteries 8 to 10% of total blood volume, arterioles the least percentage, 1 to 2% of the total blood volume. So please remember this arterioles. Least percentage of blood is present within the arterioles of our body because of the thick vessel wall. The lumen is very narrow in case of arterioles. That's why the total blood volume is only 1% in most of the book. Some books are saying 2%. Anyway, so artery is 8 to 10 and aorta contain 2% of blood volume. Now capillary, the all systemic capillaries, if you add up the total volume of blood which is present within these systemic capillaries is only and only 5% of the total blood volume, right? Then on the venous side, if you look at, so obviously venous side means venules, then a vein, and then a vena cava, right? Combination of all this is known as the venous system, which contain 64% of the total blood volume, huge capacity. So venous systems are known as the capacitance vessel. They have huge capacity to store blood. That's why you can find out that within this peripheral circulation of 84% of blood, 64% is present within the venous system only, right? And within this venous system, if I ask you that which part of the venous system contain maximum percentage of blood, then your answer will be small veins and venules. They contains the maximum 46% of total blood volume, right? And remaining portion, that means around 18% of this 64% is present within the large vein, right? Getting my point? So the maximum percentage of blood volume is present here, that is the small veins, and venules will be the answer, and the minimum percentage of blood volume is present at the level of arterioles, right? So this is the distribution of blood volume in different part of circulation, right? Now next we are going to discuss that there are a different naming system of this artery, arteriole. According to their functions, these vessels are named accordingly. So we are going to discuss this vessel system naming, but before that, few points more. Okay, so these are very simple point, that if I ask you that endothelium is present in which part, then your answer will be it is present in all vessels, right? Then elastic tissue and smooth muscle, they are present in all vessel except, so this is important, except venules and capillaries, right? So elastic tissue and smooth muscle is not present in venules and capillary. Similarly, if I ask you outermost fibrous tissue, it is also present in all vessel except this fibrous tissue is never present at the level of capillaries, right? So capillaries, they don't have any elastic tissue, they don't have any smooth muscle, they don't have any fibrous tissue also. Okay, only the endothelium and their basement membrane. That is the beauty of capillary. Okay, but still capillary never rupture. Okay, I should not say never, physiologically it will never rupture. That is cause of that. We'll discuss that at the end of this chapter, right? Now sympathetic supply, okay, present in all part of the vessel except capillary, met arterioles and precapillary sphincter. So see, arterioles, when it is giving rise to capillaries, this arterioles giving rise to capillaries, this part is known as the met arterioles. And before the origin point of each capillary, there is a sphincter which will regulate the opening and closing of the capillary, that is known as the precapillary sphincter. So there is no innervation of sympathetic as well as parasympathetic system at the level of this capillary, at the level of this precapillary sphincter, or even at the level of met arteriole. That is very, very important, that capillary, precapillary sphincter and met arteriole, they do not have any kind of sympathetic or parasympathetic supply. Okay, but parasympathetic supply is specially present in certain organ, like for example, it is present at the level of salivary gland, it is present at the level of GIT and some genital erectile tissue where it causes vasodilation. So this is the supply of different vasculature in our body, right? Now we are talking about the different types of vessels according to their functions, right? So Wien-Kessel vessel. So first, as you can find out here, the Wien-Kessel vessel. Okay. So arch of aorta or any major vessel which contain huge amount of elastic tissue, they are known as Wien-Kessel vessel, right? So I'm writing here aorta and major vessels which contain huge amount of elastic tissue. Because of their elastic expansion and recoiling, these vessels are known as Wien-Kessel vessel. Why? Wien-Kessel, you know what is Wien-Kessel? So look at this diagram here. I have taken this from a book. So here this is canal. From canal this pump is pumping the water, and here is this Wien-Kessel. So what it is doing? It is going up and down and it is generating some pressure, because of which you are giving this water here with a force, right? So same way this heart is pumping. So this pump is equal to our heart. Heart is pumping blood at the level of arch of aorta. Then arch of aorta is expanding as well as recoiling back. Because of this expansion and recoiling back of arch of aorta, it is generating some force which is pushing the blood to the distal part of circulation, and this kind of effect is seen in mainly at the level of arch of aorta because it contains huge amount of elastic tissue. That's why aorta is known as the Wien-Kessel vessel, right? Then after the aorta, next vessel is the arteries. So arteries are known as the conduit vessels. Artery are known as the conduit vessel. Conduit vessel means these vessels are only responsible for conduction of blood from one part of the circulation to other part of the circulation. Okay, there is no major role of this conduit vessel except for conduction of blood from one part to other part, right? Then third one is very, very important. You know, the resistance vessels in our body. Which vessels is known as resistance vessels? The arterioles. Arterioles are known as the resistance vessels, because if you look at the total peripheral resistance, we are going to discuss this shortly. So if you are looking at the total peripheral resistance among all vessels, maximum total peripheral resistance is exerted at the level of arterioles, and that's why arterioles are known as the resistance vessel. Arterioles are also the vessels which is responsible for determining the distribution of blood volume, in different part of body. Like for example, how much blood will be diverted to brain, how much blood will be diverted to liver. This is determined by constriction and relaxation of the arterioles, right? Because if you causes decrease in resistance, because arterioles are the resistance vessel, then more blood flow will be diverted to an organ. But if you causes constriction of this arteriole, then less blood flow will be diverted to that organ, right? So this way, arterioles are also responsible for distribution of blood volume in different part of the body by constriction and relaxation, right? Then we all know that exchange vessels is nothing but the capillaries. Okay, so capillaries are known as the exchange vessel. Why? Because we all know that capillaries, there is no elastic tissue. Okay, there is no smooth muscle surrounding this capillary, there is no fibrous tissue. So the gaseous exchange, oxygen and carbon dioxide exchange, is very easy at the level of capillaries. That's why the capillaries are known as the exchange vessel. Okay, then capacitance vessels we have already discussed. Capacitance vessel means these vessels has the huge capacities to store huge amount of blood, and the venous system is known as the capacitance vessel. So venous system is known as the capacitance vessel. And the last here it is written the shunt vessels. You know that there are normally in our body there are certain artery venous anastomosis, and this artery venous anastomosis is done by certain vessels which are known as the shunt vessel. They have very thick muscular wall. Okay, their muscle wall is very thick, which is richly innervated. Means this shunt vessel, this will be easily constricted and relaxes because they are richly innervated by sympathetic system, and they have thick muscular walls. This muscular wall contain huge amount of smooth muscle. So whenever sympathetic system is stimulating this smooth muscle, there will be constriction, and whenever sympathetic system is not there, there will be relaxation of these vessels. By this way, they are helpful for regulation of temperature, mainly at this location. Where at the location, the tips of the finger as well as at the level of ear lobules. So at these locations, the shunt vessels are normally present, right? So now after discussing all these different types of vessel according to their functions, now we have to look at the level of this capillary. Okay, exchange vessels, capillaries. Why? Because you have to remember a classification of different types of capillary. So I'm writing here different types of capillary, types of capillaries in our body, types of capillaries in our body, right? So if you look at the structure of the capillaries, I told you already that it is only composed of endothelial cell. So suppose these are the endothelium cell, right? And in between endothelium cell there is a little gap. Depending on this gap, you know, that's depending on this gap which is present in between these two endothelium cell, three different types of capillaries are present in our body: continuous, fenestrated, and sinusoidal, right? So I'm writing here, number one type of capillary is continuous type of capillary. Continuous type of capillary, right? So in continuous type of capillary, I can easily understand that the gap will be lesser. So I'm writing here the gap is less than 20 nanometer, right? Then second division is the fenestrated type of capillary. Fenestrated type of capillary. So here the gap will be a little more. Okay, so in case of fenestrated capillary, the gap is generally 20 to 80 nanometer, right? And in case of sinusoidal capillary, number 3 is the sinusoidal capillary. So I'm writing here sinusoidal capillary. In case of sinusoidal capillary, the gap is very huge, 300 to 600 nanometer. Getting my point? So this gap you may not remember, but at least you remember this continuous type of capillary, fenestrated capillary, as well as this sinusoidal capillary. Now we have to remember the examples that in which locations these different types of capillaries are present. So continuous capillary. So continuous capillary are again of two types. Okay, I'm writing first, then I'll explain. So with tight junction, okay, and with loose junction, with loose junction, right? So what is the meaning of this? I hope by the time you know what is the meaning of tight junctions. Okay, so this is a junction between cell to cell. Okay, like for example we have seen gap junction. So this tight junction we have also discussed at the level of your general physiology. Okay, it is formed by a protein which is known as claudin and occludin. In case of certain capillaries, in between two endothelium cells, tight junctions are also present, right? So if this kind of tight junction is present, then that type of continuous capillary is known as continuous capillary with tight junctions. Examples, obviously, it will be present at the level of brain capillaries. Not only brain, obviously, it also has to be present at the level of spinal cord capillary. Not only that, the enteric nervous system, the nervous system which is present inside the GI tree, okay, that also contains this tight junction continuous capillary, as well as it is also present at the level of retina, right? Now tight junction where it is not present, so that type of continuous capillary is known as continuous capillary with loose junction. So capillary is continuous but the tight junction is not present. The example of such kind of capillary are present at the level of lungs, okay, at the level of skin, at the level of muscle, right, even at the level of adipose tissue, as well as specially remember the cortical bone. Generally bone marrow contain the sinusoidal type of capillary, but cortical part of the bone contain continuous type of capillary, okay, as well as the GIT. Normally GIT contain fenestrated type of capillary, that is in the intestinal villi and all. But if you look at the mesentery of the GIT, then it also contains continuous type of capillary, right? So these are the examples that you have to remember. Now coming to the fenestrated capillary. So fenestrated capillary, the gap is large one, 20 to 80 nanometer. We know the example, some of the example we know, like for example kidney at the level of glomerulus, okay, not only at the level of glomerulus, also at the level of peritubular capillary, this fenestrated type of capillary is present. And we were talking about GIT, the intestinal villi, they also contain fenestrated capillary. Not only that, all the endocrine as well as the exocrine type of glands, they contain this kind of fenestrated capillary, right? And lastly, the sinusoidal, where the gap is very, very high, the sinusoidal capillary is typically present at the level of bone marrow, right? It is typically present at the level of bone marrow. It is also present at the level of spleen, and it is also present at the level of liver, okay. The maximum gap is present at the level of liver. So if I ask you in which part of the capillaries the gap is maximum between two endothelium cell, your answer is liver. And obvious reason, the minimum gap is present at the level of brain. So this is the most continuous type of capillary in our body, and the largest gap is present in case of capillaries of liver, right? So these are the things that we have to remember about different types of capillary. Now in our body, some of the capillary, they are surrounded by a special type of cell. So you have to remember the name of this cell, because sometimes MCQ can be given from here. So capillaries are surrounded by a special type of cell in certain places of capillary, like for example retinum in case of skeletal muscle, in case of lung. In this area, this cell are surrounding this capillary. The name of the cell is pericyte. So just remember the name of this cell, pericyte. Okay, so pericytes are present surrounding the capillaries at the level of retina, okay, at the level of lungs, at the level of skeletal muscle, right? So what the pericyte is doing? Pericyte basically it secretes certain secretion of certain vasoactive substances. Okay, it secretes certain vasoactive substances. Not only that, it regulate, okay, it regulates the permeability of the capillaries, permeabilities of the capillaries. And not only that, remember that pericyte are contractile cell, contractile cell. So by causing constriction and relaxation, it can also regulate the permeability of this capillary. So this is about pericyte that you have to remember. So now we came to know that different types of blood vessel, different types of capillaries and pericyte. Okay. Now after knowing all this basic part, now we are going to discuss the next part of this hemodynamic, that is blood flow within the vessels. Right. So how to calculate the blood flow within vessels? Very simple. The calculation will be done by a basic principle or basic law, which is nothing but Ohm's law. Right, Ohm's law. So suppose the blood is flowing through these vessels. Okay. The pressure at one end of the vessel is P1 and the pressure at the other end of the vessel is P2. Okay, and resistance of this vessel is R. So if I want to calculate the blood flow, it will be calculated by Ohm's law, which is saying V is equal to IR. So V here is nothing but the potential difference. Potential difference means the difference between this P1 and P2. So basically this P1 minus P2 is the potential difference. This will be equal to I. I is the current flow. So in case of cardiovascular system, this is blood flow, and R is the resistance. So simple thing is that if you want to calculate the flow, then it will be nothing but P1 minus P2 upon the resistance of this vessel, right? So why we are discussing this? This is very simple. Okay, for physics, this is a very simple formula, but sometimes in our cardiovascular system, some of the MCQs are based on this formula only, right? Look at this MCQ that already been asked in NEET examination. So a 22-year-old man has a muscle blood flow of this. Okay, so muscle blood flow is given. So what is given? The flow, okay, is given, that is 250 ml per minute. He has a mean arterial pressure, okay, of 130 millimeter of mercury and a venous pressure of 5 millimeter of mercury. Means this vessel mean arterial pressure is pushing the blood through here, which is 130, okay, and the venous end pressure is 5. So obviously I can calculate the potential difference, that is P1 minus P2 is 125 millimeter of mercury. So this is the force or this is the pressure which is pushing the blood through these vessels, right? And we also know what is the flow during the passage of this blood. So obvious thing is that how to calculate this resistance based on this Ohm's law. Okay, so V is equal to IR. So I is equal to P1 minus P2, that is 125 millimeter of mercury upon your blood flow, that is 250 ml per minute, right? So this will be nothing but 0.5 ml per minute per millimeter of mercury, right? Very simple, very simple. So this way question can be given. That's why I am showing you the MCQ here, right? So this is all about the blood flow. Now we all know that if you want to calculate the resistance directly by knowing the length and other parameter of the vessels, then we have to apply another formula, that is R is equal to resistance of a vessels is equal to 8 eta L by pi R to the power 4. We know this formula. Okay, so here in this formula, this eta is nothing but viscosity of blood. L is nothing but it is the length of the vessels, and R is nothing but the radius of the vessel where you are calculating the resistance. So this is nothing but this formula, this is nothing but known as Hagen-Poiseuille's law. Okay, Hagen-Poiseuille's law. Okay, so this is known as Poiseuille's Hagen formula or Hagen-Poiseuille's law, right? So discovered by these two scientists, Hagen and Poiseuille. That's why this is known as Hagen-Poiseuille's law or Hagen-Poiseuille's formula. So based on this law or formula, I can easily understand that resistance of a vessel is inversely proportionate to radius to the power 4 if other parameter remain constant. Obviously, length is also a determinant of this resistance, viscosity of blood is also a determinant of resistance, but they are less important than that of the radius because the resistance is changing with to the power 4 of radius. Even little amount of change in radius or diameter of the vessel will change the resistance significantly, right? So to apply this formula, okay, you may be given some MCQ. So look at the MCQ which is already given, so that they are checking that how you are applying this Poiseuille's Hagen law. So look at the question. So calculate the change in resistance in a vessel after 50% decrease in vessel radius. Right. Suppose any vessel, coronary vessel or any other vessel, due to atherosclerotic plaque or anything, the diameter, the radius of the vessel is decreasing. And how much is decreased? 50% decrement of the radius. They can also be given a 50% increment of the radius. But your basic thing is that if your normal radius is, suppose the normal radius is 1 r, right? So after 50% decrement means, obvious thing is that 50% decrement means now the radius is half of the r. So obviously, if I want to calculate how much resistance is going to change, so this is inversely proportionate to r to the power 4. So I am writing this half r to the power 4. So this is nothing but increment of resistance, that is 16 times than that of the normal resistance. Getting my point? So this way you have to calculate that how much change of resistance is going to happen, right? Okay, they can also be given as 50% increment. So 50% increment means new radius will be that 1 plus half r, okay, that is 3 upon 2 r. So if it is given as 50% increment, then you have to put here this 3 upon 2 r, and that way you will get that how much resistance is going to decrease whenever there is increase in radius of these vessels. So this way you have to go in a step-by-step fashion. Okay, now we look at, so now we know the calculation of resistance of a vessel whenever we are getting the pressure difference between two end and flow. That way you can also calculate the resistance, or if you get the radius of a vessel or length of the vessel or viscosity of this parameter, then also you can calculate the resistance of a vessel directly. Now suppose by this Poiseuille's Hagen law, I have calculated the resistance of outer. Okay, suppose that resistance is R1, right? So suppose this is the R1, resistance of outer. Then I have also calculated the resistance of artery. Suppose that is R2, that is the resistance of artery, right? Then calculated the resistance of arterioles, and the arterial resistance is suppose R3. Okay, so this is more resistance. Okay, so R3. Then I have also calculated the capillary resistance. Suppose that is R4. Okay, and the whole venous system resistance, that is R5. That is R5. That is the venous system resistance. Now, if I ask you, all these resistance, they are connected in which kind of circuit? Okay, the circuit of physics. Okay, so obviously all of you can answer that, sir, all these resistance, they are connected in series circuit, because outer is connected with artery, then artery is connected with arterial. So this way all these resistance are connected in a series circuit. So if I ask you, what is the formula to calculate the total resistance of all these artery arterioles up to the venous system, then total resistance R is equal to R1 plus R2 plus R5, right? So if you calculate the total resistance by this way, okay, so you are adding up all the resistance of all the vessels starting from aorta, artery, arterioles, okay, capillaries as well as venous system. Then this total resistance is known as TPR, total peripheral resistance, or systemic vascular resistance. Getting my point? So total peripheral resistance, from the name, if you analyze total peripheral resistance, you are adding up the resistance of all the peripheral vasculature starting from aorta up to the level of venous system, but you are not adding the resistance of the pulmonary circulation. So that is the meaning of total peripheral resistance, or TPR, which is also known as systemic vascular resistance. Okay, so systemic vascular resistance, or TPR, is calculated by adding up resistance of all the vessels. Is there any other way to calculate the systemic vascular resistance, or TPR? Answer is yes. We can also use the Ohm's law formula here. How to apply the Ohm's law here? So suppose this is the heart, right? This is the heart. And the heart is pushing blood from this left ventricle at the level of arch of aorta, and that blood is flowing through, and it is reaching at the level of right atrium, right? So if I think that this is the whole peripheral circulation, this red color line is the whole peripheral circulation, okay, where I should calculate the P1. I want to calculate the potential difference, P1 minus P2. I want to apply Ohm's law here. So P1 is the pressure with which the blood is pushed, okay, out of the heart, okay, that is the aortic pressure. So aortic pressure is pushing the blood through the, okay, so P1 is equal to aortic pressure. Which aortic pressure I should take? Mean aortic pressure, okay, and P2, that means the pressure at the other end of this vasculature, okay, P2. So where all this blood is draining, that is the right atrium. That means P2 here is nothing but right atrium pressure. So I have already got this P1 minus P2, that is the potential difference, that is V, is equal to IR. So now I have to find out I and R. This R is nothing but the total peripheral resistance that I want to find out. So now I have to find out what is the I in this case of circulation. So what is the blood flow through this peripheral circulation in 1 minute? Remember, in 1 minute, all of your cardiac output is going to flow through this vessel, right? Yes, because whatever blood is ejected by the left ventricle, that blood is supposed to flow through the vessels in 1 minute, and that is nothing but cardiac output. So in these cases, I is equal to cardiac output. So simple, I can easily calculate this R, which is nothing but total peripheral resistance of this vasculature is equal to P1 minus P2, that is MAP, mean arterial pressure, minus right atrium pressure upon your cardiac output. Getting my point? Very, very important. This question has not been given till date, but believe me, this is going to be given soon in your future examination, right? So calculation of the total peripheral resistance by this formula, MAP minus RAP upon your cardiac output. Okay, now look at the MCQ. Okay, how the MCQ will be given. So this is one MCQ. Look at this. A drug increases the cardiac output by 30% and decreases the mean arterial pressure 10%, assuming that the central venous pressure, so the central venous pressure is nothing but right atrium pressure, that is equal to 0. So, okay, so they are asking you that what percentage does this drug changes the systemic vascular resistance. So basically, we have to apply the formula of this TPR, or systemic vascular resistance, is equal to MAP minus RAP upon your cardiac output. But because RAP here is 0, that is given, so I can easily understand that here I have to apply this formula, that SVR is equal to MAP upon your cardiac output. Now MAP, it is given that it is decreased by 10%. So 10% decrease means if the original MAP is 1, then after decrement it is now 0.9. Getting my point? Original is 1 MAP, now it is decreased to 0.9, 10% decrease. And cardiac output 30% increase, means original cardiac output, if it is 1 unit, then now it will be 1.3, right? So if I divide these two, it will be equal to 0.69. That means I can understand that the systemic vascular resistance is now reduced to 69% of the original. So whatever was the original systemic vascular resistance, that has reduced to 69%. So what percentage does this drug changes the systemic vascular resistance, right? So how much percentage change occurs? So 100% minus this 69%, that means 31% of change of vascular resistance has occurred here. Okay, so the SVR has reduced to 69%. They are asking how much percentage of change has occurred. So from 100 to 69%, that means 100 minus 69 is 31% change of SVR has occurred by this drug, right? So this way you can get applied question, okay, based on this simple formula, how to calculate the systemic vascular resistance, right? Now next question is that we have now understood that what is the meaning of TPR, okay, and what is the meaning of TPR or SVR, whatever, right? Now if I ask you that within this R1, R2, R3, R4, R5, among all these resistance is maximum at which level, then we already discussed that maximum resistance, maximum TPR, maximum SVR will be exerted at the level of arterioles. Why so? Why not at the level of capillaries? Because just now we have also discussed that resistance is inversely proportionate to the power 4 of radius, right? So capillary radius or capillary diameter and arterioles diameter, if you look at, obviously capillary diameter is very less, 6 to 10 micrometer, and arteriole diameter is more than that of the capillary diameter. So look at, so I am asking that this is the arterioles, okay, this is the arterioles and this is the capillary diameter, okay, capillary diameter, suppose. So diameter or radius of the capillary is very lesser than that of the arterioles. So maximum resistance should be exerted at the level of capillaries, but it is not that. It is at the level of arterioles. So why arterioles are known as resistance vessel? Why resistance is maximum at the level of arterioles, right? Whenever we are talking about resistance of capillaries or resistance of arteriole, we are calculating the resistance of all the capillaries in our body, all the arterioles in our body, right? So all the capillaries, all the arterioles, okay. So whenever we are talking about this R1, R2, R3, this is the resistance of all the arterioles of your body, all the capillaries of your body. Now, number of capillaries in our body are very huge than that of the arterioles, obviously. And if you look at the capillary arrangement in any organ system, then you will be finding out that capillaries are present in parallel circuit like this. So capillaries will be present in parallel circuit like this. So if you calculate the resistance of a single capillary, remember, very important, if you calculate the resistance of a single capillary, suppose this is R1, resistance of a single capillary, suppose R2, R3, R4, R5, R6, or this is R7, what will happen? The resistance of a single capillary is very huge than that of a single arterioles, right? So I'm writing here, single capillary resistance is very huge than that of the single arterioles resistance. Obviously both of them are single, but whenever we are talking about resistance of the capillary, resistance of the arterioles, we are combining the resistance of all the capillaries in our body, and all the capillaries, they are present in parallel circuit. If I ask you, calculate the total resistance of all these capillary which are situated in parallel circuit, we know the formula for calculation of resistance, total resistance in parallel circuit, that is 1 upon R is equal to 1 upon R1 plus 1 upon R2 plus ... 1 upon R7. So now you can understand that more and more parallel resistance you are going to apply, what will happen to the total resistance? The total resistance is going to fall. That's why whenever you combine the resistance of all capillaries in our body, they are very low, right? That's why the maximum resistance is not exerted at the level of capillaries, but it is exerted at the level of arterioles. Okay, now arterioles, they have a special feature. What is that special feature? The vessel wall. Okay, so suppose this is the arterioles, this is the lumen, and this is the vessel wall. The thickness of the vessel wall is very thick due to presence of huge amount of smooth muscle. So if I ask you, maximum amount of smooth muscle is present in which part of the vessel, then your answer is this is nothing but arterioles, right? So maximum number of elastic tissue is present at the level of your aorta, but maximum number of smooth muscles, so this is nothing but smooth muscle cells, okay, and they are maximally present in which type of vessel? Arterioles. And we all know that these smooth muscles are richly supplied by sympathetic system. That's why whenever you stimulate the sympathetic system, the smooth muscle is going to contract, and that is nothing but vasoconstriction, right? And if the smooth muscle is relaxed, then that is nothing but vasodilation. Now, because of the presence of this huge amount of smooth muscle at the level of vessel wall of the arterioles, the lumen aperture is reduced. And because of the reduction in the lumen aperture, the resistance of the arterioles are very high. So that way, if you combine the resistance of all the arterioles, that is huge in comparison to any other vessels, and because of which the arterioles are known as the resistance vessels. Getting my point? So this way you have to remember that how this blood flow, okay? So everything we have discussed about this resistance, okay? Now, next part is the type of blood flow, right? Now, next part is the type of blood flow. So, after discussion of the resistance, now type of blood flow. Okay, so all of you know that if these are the two vessels, okay, one of the type blood flow is known as the laminar blood flow, and another one is known as the turbulent blood flow. Okay, so laminar blood flow, if you look at the diagram, so you will be finding out that velocity of blood is maximum at the center of the vessels, and whenever you are moving from center towards periphery, the velocity of the blood is gradually reducing. Okay, that is due to the frictional force towards the vessel wall, right? So now if you look at the profile of this blood flow, then it is maintaining a parabolic profile. That's why it is known as that laminar blood flow maintains a parabolic profile. So this is nothing but a parabolic profile of blood flow. Okay, in that parabolic profile, the centermost blood, okay, they are flowing at a huge velocity than that of the peripheral. So if you look at this diagram, you are finding out as if the blood is flowing like a layers. One layer of blood is flowing over another layer, and that is flowing over another layer. So with these layers after layers blood flow, the name is coming as laminar. So as if the blood is flowing as a layers after layers, one layer is flowing above another layer, and the velocity of the central layer is maximum. Whenever you are going towards periphery, because of the resistance, the velocity is decreasing. That's why it is maintaining a parabolic profile. Laminar blood flow is always silent in nature. Silent means no sound will be produced, no noise will be produced during this type of flow inside the vessels, right? If you put a stethoscope, you are not going to pick up any sound of this blood flow. But suppose there is an obstruction here at the vessel wall. So whenever there is an obstruction, what will happen? All this laminar blood flow will be disturbed, and the blood will be diverted in different direction. Okay, so different direction. This kind of blood flow where the direction is very haphazard, this is known as the turbulent blood flow. So it is not maintaining this layer, subtle layer type of profile. Okay, and this is known as turbulent. Whenever there is turbulent blood flow, it will always produce some noise. So remember, turbulent blood flow is noisy in nature, right? So when this turbulent flow is going to happen, to discuss that, before that, look at the examples of this turbulent blood flow. Okay, all kind of murmurs which originate at the level of heart, that is due to turbulence of blood flow. You know that during blood pressure measurement, you receive a sound in your stethoscope that is known as Korotkov sound. Okay, so that Korotkov sound, any kind of murmur, okay, they are examples of turbulent blood flow. Because of the sound, you are getting some sound in your stethoscope, right? Okay, because of the turbulent blood flow. So now, can I determine that inside the blood vessels whether the blood flow will be laminar or turbulent? Answer is yes, by calculating a number, and that number is known as Reynolds number. That number is known as Reynolds number, right? So Reynolds number is denoted by Re. Re is equal to rho d V, rho multiplied by d multiplied by V upon your, okay, eta, rho dV upon your eta. So here the rho is the density of the blood, right? D is the diameter of vessels, V is the velocity of the flowing blood, and eta is the viscosity of the blood, right? So if you put all this, okay, the density of the blood, the diameter of the blood, diameter of the vessels, the velocity of the blood flow, and this viscosity, and then you are going to get a number. This number is known as the Reynolds number, right? If this Reynolds number is greater than 3000, then almost always there will be turbulent blood flow. Getting my point? So please note down, this is very important for MCQ. Whenever your Reynolds number is greater than 3000, you are going to get which kind of blood flow? Turbulent kind of blood flow, noisy blood flow. And if your Reynolds number is less than 2000, then always you are going to get the laminar type of blood flow. Means more the Reynolds number, more is the probability of kind of turbulent flow. Okay, and if the Reynolds number is between this 2000 or between this 2000 to 3000, okay, then it is said that the blood flow will be transitional between laminar to turbulent. You cannot say whether it will be laminar or turbulent. 100% surety, with 100% surety, you cannot say whether the blood flow will be turbulent or laminar. It will be transition between turbulent to laminar, right? But whenever it is greater than 3000, always there will be turbulent. When it is less than 2000, always there will be laminar blood flow. Now, during calculation of this Reynolds number, if I ask that there are 4 different parameters which is deciding the Reynolds number. Among these 4 parameters, okay, which is the most important parameter? Remember, most important parameter is the velocity. So, velocity is the most important determinant of the turbulent flow. You have to remember, one velocity is known as the critical velocity. Okay. Critical velocity means the velocity above which the blood flow always will be turbulent in nature, irrespective of the diameter, irrespective of the other parameter. So what I am saying, the critical velocity is velocity above which the blood flow is always turbulent in nature, irrespective of the diameter and other parameter of the vessel. That is the meaning of critical velocity. So now question is, how the velocity of the blood flow is determined, right? So velocity of blood flow is inversely proportionate to cross-sectional area of the vessels. Remember this also. Velocity is inversely proportionate to cross-sectional area of the vessels. So A here, A is nothing but it is the area, cross-sectional area. Total cross-sectional area of a vasculature. Total cross-sectional area of a vasculature. A, right. So, if I ask you that velocity of blood flow will be maximum in which vessel, then you have to look at the cross-sectional area of that vessels. When the cross-sectional area is minimum, then velocity of the blood flow will be maximum and the vice versa. So, if I ask you, tell me that cross-sectional area A is maximum for which vessel? Now you have to remember this, you have to memorize this. Cross-sectional area A, it is maximum for which vessels? Capillaries, right? What do you mean by capillaries? If you look at the cross-section of a single capillary, that will be very, very less. But if you look at the cross-section of an aorta, that will be very large. So what do you mean by this cross-sectional area? I am telling you that I told you here that it is nothing but total cross-sectional area. Total cross-sectional area means if you add up the cross-sectional area of all the capillaries in your body, okay, and if you add up cross-sectional area of the other vessel in the similar way, then it is maximum at the level of capillaries. Obviously, because number of capillaries are huge, although the individual cross-sectional area of a single capillary is very less. But here we are talking about total cross-sectional area of all the capillaries in our body. So, cross-sectional area A is maximum at the level of capillaries, followed by venules, followed by vein, followed by arterioles, followed by artery, okay, followed by vena cava, and last is the aorta. Getting my point? So this sequence you have to remember. The cross-sectional area is maximum in case of capillary, followed by venules, vein, arterioles, artery, vena cava, and aorta is the least cross-sectional area. So obvious thing is that if I ask you a question that velocity of blood flow is maximum in which vessels, then obviously the answer is aorta. And the velocity of blood flow is minimum at which area, then your answer is capillaries. Okay, your capillaries, right? So look at, I told you at the beginning of this turbulent and laminar discussion, right, that whenever there is an obstruction in the vessel wall, here I was talking about that whenever there is an obstruction in the vessel wall, okay, there will be a kind of turbulent flow. So why I said that? So whenever there is an obstruction, I can understand that the diameter of this part of the vasculature will be reduced. Okay, so if you look at this Reynolds number parameter, okay, Reynolds number parameter, this diameter is reducing. Okay, but look at the V, what will happen to the V? So whenever there is reduction in the diameter, what will happen to the cross-sectional area of this part? The cross-sectional area A will be decreased. If the cross-sectional area A is decreased, then what will happen to the velocity? Velocity will be increased. And if the velocity is increasing, then I told you that the most important parameter for determination of this Reynolds number is velocity. And that's why whenever there is any obstruction in the vessel, obstruction in the heart valves, the velocity of blood flow through that stenostic valve or the velocity of the blood flow through that stenostic vessel will be very, very high, and because of which this Reynolds number will be higher, and most probably the flow will be turbulent in nature, and that will produce some sound. Getting my point? So this way you have to remember the concept of this critical velocity, cross-sectional area, and this velocity of blood flow in different part of the cell. Now, after discussing all this thing, I'll show you a diagram from Genome, right? So this diagram is taken from Genome. So first you look at the curve which is given in the bottom of this graph. So this is mean velocity. Okay, mean velocity is plotted in y-axis. Just now we are discussing velocity. Okay, and velocity is inverse of cross-sectional area. So first you look at this cross-sectional area. You look at the velocity. Velocity is here, and this is inverse of cross-sectional area. This is the cross-sectional area, TA. So this TA is the total area. it is nothing but total cross sectional area, right? So this is the total cross sectional area which we are discussing here, total cross sectional area. So look at this total cross sectional area curve. If you follow this curve, so you are finding out that cross sectional area is suddenly rising to a very peak level, and that is at which vessel level? That is at the level of capillaries. Getting my point? So look at this yellow color highlight. Okay, yellow color highlight. This is the total area, cross sectional area, and velocity of blood flow will be opposite, means minimum velocity. So now you look at this pink color, okay, highlight. So again I am highlighting. So velocity of blood flow is very high at the level of aorta, then it is reducing to a very minimum at the level of capillary, and then it is again rising towards the venous system, but that rise is never equal to the aortic blood flow velocity. So blood flow velocity is maximum at the level of this vessel, that is the aorta, and minimum at the level of this capillary, but it is rising towards the venous system. So if I give different venous system part, venules, vein, vena cava, velocity of blood flow will be maximum in which vessel? Your answer will be vena cava, right? Because venules, vein is here, okay, just after the capillary. So velocity of blood flow will be lesser there, right? So this way you have to answer different question depending on your choices in the MCQ. Now apart from that, you look at the RR. So what is this RR? This RR is nothing but the relative resistance of different blood vessels. So you can find out that the maximum resistance here at the level of these arterioles, that we have already discussed. That's why arterioles are known as resistance vessel. Now, if the resistance is very high inside a vessels, what will happen? Whenever the blood is flowing, there will be huge amount of drop of pressure at the point of huge resistance. That's why, look at this, systolic blood pressure and diastolic blood pressure at the level of this aorta and major arteries, it is very high. Systolic and diastolic blood pressure is very high. On an average, the mean pressure in this region is 90 millimeter of mercury. Okay, that pressure is around 60 millimeter of mercury here. Suddenly it's dropped to 25 millimeter of mercury at the level of capillary. So what I am saying, the average blood pressure or mean blood pressure at the level of this aorta and arteries is 90 millimeter of mercury. This blood pressure is 60 millimeter of mercury at the level of these arterioles. Suddenly it is dropping to 25 millimeter of mercury at the level of capillaries, right? So it was like this, 90, then 60, suddenly it is dropping to 25 millimeter of mercury. Why? Because after these arterioles and capillaries, the blood is passing through these arterioles. So whenever it is passing through the arterioles are the resistance vessel, that's why sudden drop of blood pressure is occurring. Okay, so that is at the level of capillary. Now the average blood pressure at the level of these venules is around 15 millimeter of mercury, at the level of vein around 12 millimeter of mercury, and at the level of vena cava is very less, that is around 3 millimeter of mercury. So this way you may remember this average blood pressure, that is not very important, but you remember that arterioles are known as the resistance vessel. At the level of arterioles, the maximum drop of blood pressure occurs from 60 to 25, that is the surface drop of blood pressure occurring. So that is due to arterioles, right? So this is the diagram which is given in yellow. Now after this we are going to another property, another physics principle in cardiovascular system, that is Laplace law. So all of you know this Laplace law, I hope. Okay, so this is the blood vessel, right? So if I look at the luminal pressure of this blood vessel, okay, so this pressure is the luminal pressure of this blood vessel. It is trying to causes distension of these blood vessels. So this is P, pressure, luminal pressure. Now the tension which will be generated at the level of this vessel wall. So what is this vessel tension? What is this tension at the level of this vessel wall? Tension is the force which will try to tear up the blood vessel, which will try to rip up the blood vessels. That means these blood vessels are arranged like this. So tension means it will try to rip up this part of this blood vessel. So it is said that tension is that force which is trying to tear up the blood vessels. Okay, So there is a relationship between this tension on the vessel wall and the luminal pressure, and that relationship is by Laplace law, which is equal to P is equal to T upon R. R is nothing but the radius of this vessel. So if this is the radius of this vessel, then Laplace law is saying that P is equal to T upon R. That means I can calculate the tension on this vessel wall, that is T, is equal to P luminal pressure multiplied by radius of that vessel, and this is nothing but Laplace law. Now, what is the application of this Laplace law? This is applied in many aspects in cardiovascular system and respiratory system. But look at, according to the Laplace law, if I have a vessels with a large diameter vessel and a small diameter vessel, suppose this small diameter vessel is capillary. Okay, this small diameter vessel is capillary and this large diameter vessel is arterioles. In both of these vessels, I have given a luminal pressure of 25 millimeter of mercury. 25 millimeter of mercury, right? That means P in both these vessels, P is equal in both these vessels. P1 is equal to P2. Luminal pressure is same to same in both these vessels. But I can easily understand that the tension which will be generated here, okay, will be more than that of the T2, because the tension is the multiplication of this luminal pressure by radius. Because of the more radius at the level of this large vessel wall will develop more tension, so there is more chances of rupture of this large vessel rather than this small vessel. That's why we know that the capillary, although the wall is very thin, only the endothelium cell, there is no elastic tissue, no smooth muscle, no fibrous tissue, but still capillary is not rupturing in our body, and that is due to low wall tension at the level of capillary. And why the wall tension is very low at the level of capillary? Because of their smaller radius. So smaller the radius, smaller will be the wall tension, less chances will be rupture. Okay, but because the arterioles and other artery, they have large diameter, there will be more wall tension, and more wall tension means more chances of rupture, and that's why we require elastic tissue. That's why we require huge amount of smooth muscle to protect the rupture. Getting my point? That's why these vessels are equipped with more amount of elastic tissue, more amount of smooth muscle, right? Second application of this, suppose a normal heart and a dilated heart due to heart failure or due to dilated cardiomyopathy. So one normal heart and one dilated heart. So normal heart and dilated heart. So wall tension T1, and suppose this is T2. So obviously I can understand in this cases T2 will be more than T1, means dilated heart wall tension will be more. And remember, we will be discussing that wall tension more means the heart muscle will consume more oxygen. Oxygen requirement of the myocardium is directly proportionate to the wall tension. That's why it is asked in your question that why dilated heart consume more oxygen than normal heart. Your answer will be, according to the Laplace law, the wall tension is more in dilated heart, because Laplace law is saying the luminal pressure multiplied by this R is equal to the wall tension, and wall tension is directly proportionate to the oxygen consumption of the muscles. That's why the dilated heart consume more oxygen. That is also discussed with the help of this Laplace law. Okay, and the last law that we are going to discuss is the Bernoulli's principle, right? So according to Bernoulli's principle, again I have to draw a blood vessel. So suppose the blood is flowing through a vessels, right? So whenever the blood is flowing, it will exert two pressure. One pressure will be exerted on the lateral aspect of the blood vessel. So that is nothing but known as the lateral pressure. Okay, lateral pressure is due to the potential energy of the flowing blood. Potential energy, right? And this blood will also exert one end-on pressure. So this pressure is known as the end-on pressure, end pressure, which is due to the kinetic energy of the flowing blood, and kinetic energy is equal to half mv square. Okay, so this is proportionate to, okay, half mv square. So this is v. Okay, this is lambda mv square, means I can understand that this kinetic energy is directly proportionate to the velocity of the flowing blood. M is the mass and v is the velocity. Okay, so mass is constant and velocity. So more the velocity, more will be the kinetic energy, more will be the this end pressure. But what Bernoulli's principle? Bernoulli's principle is saying that the total energy of this blood flow, total energy of this blood flow, that is equal to the potential energy plus kinetic energy. This will always remain constant inside a vessel. It will always remain constant inside a vessel during the blood flow. That means whenever I am saying that P plus Ke is equal to constant, then whenever there is increase on one component, there will be decrease on the other component. And the same thing will be explained by this diagram. So look at this diagram here. Suppose this blood vessel wall, there is an atherosclerotic plaque here. So there is an atherosclerotic plaque on the inner surface of this blood vessel. So what will happen? So whenever there is, okay, constriction of the lumen aperture, okay, the cross-sectional area at this point will be lesser. If this cross-sectional area is decreased, okay, I told you already, what will happen to the velocity? Velocity is going to be high. So I can understand that this area where the atherosclerotic plaque has been formed, the velocity of blood flow will be very, very high. And whenever velocity of blood flow increases, I can understand that the kinetic energy of this portion is very huge. So what will happen to the potential energy or the lateral pressure on this part where the atherosclerotic plaque has formed? There will be decrease in potential pressure, potential energy or lateral pressure. Please remember, this potential energy or this lateral pressure, it is the pressure which will try to distend the blood vessel. It is the pressure which will try to cause distension of the blood vessels. So if there is an atherosclerotic plaque on this vessel, then this distending pressure at the level of this stenotic part will be lesser. So what will happen? This will lead to more and more plaque formation. This will lead to more and more vessel constriction. Generally, we think that if there is constriction, the blood pressure will try to expand this portion. But no, we are not finding out that. We are finding out that the potential energy at that part where this constriction is already there, the potential energy will be reduced. That's why the distension force on that part will also reduce, and more atherosclerotic plaque will be deposited here. Right? So this way we can explain this Bernoulli's principle here. Another important applied Bernoulli's principle application is here. So suppose this is the left ventricle and this is the arch of aorta. This is your, okay, aortic valve and it is stenosed. So aortic stenosis, right? So whenever there is aortic stenosis, I can understand that the aperture of this valve, okay, is lesser. So again the same principle will be applied, that what will happen to the velocity of the flowing blood through this aortic valve? Velocity will be very, very high. Whenever velocity is very, very high, the Reynolds number will be also very, very high, and that will lead to turbulent blood flow, and turbulent blood flow will produce murmur, that we have already discussed. But now look at, in regional circulation, I will be discussing the coronary arteries. Okay, coronary perfusion. You all know that coronary arteries, they originate from this root of the aorta. So this is the area where the coronary vessels are originating. So if I ask you perfusion pressure of this coronary artery, that is due to this kinetic energy or that is due to the potential energy? Perfusion, the blood which is flowing through the coronary artery, which pressure is pushing the blood through the coronary artery? The end-on pressure or lateral pressure? Obviously lateral pressure. So I can understand that the potential energy is going to perfuse the coronary artery. But whenever there is aortic stenosis, the velocity is very, very high, due to which the kinetic energy will be higher. But Bernoulli's principle is saying total energy will remain constant. So what will happen to the potential energy? Potential energy will decrease, and that's why we can understand that the coronary perfusion pressure will be reduced, and because of which the aortic stenosis patient is more prone to ischemic damage of these ventricular muscles. So again, this is an application of Bernoulli's principle. I hope you understand this hemodynamics part in brief. So this is all about cardiovascular hemodynamics.